policy when you leave it in the statute.
Well, it's not even in the statute. Then we
which I know many of you are aware of and some of you participate in. So this year we received the Impact Award, which is just recognition that an audit report we did had a significant impact on affecting public policy. And so that was our audit on mental health services provided in local jails. back in 2018. And so that was actually Kristen Ridinghouse here supervised that audit at the time, and Megan Flanders, actually there in the back, she'd like me to call her out, was part of the team that did that work. So very pleased. That marks over now a consecutive decade of different national awards we got. So very proud of the team, very fortunate to have such talented people working with me. So thank you, Madam Chair.
All right, and thank you, Justin and team, because it's wonderful to work with you. I think we're impressed by all the things you're able to manage and work with the legislative chamber. So we appreciate all your hard work. All right, with that, we're going to move to our first item of business, the foster care case plans. And I'd like to recognize Josh from LPA to present this audit. Welcome, Josh.
All right, I believe this is on. I see the green light. All right, so thank you, Madam Chair, members of the committee. My name is Josh Luthai, and I'm presenting an audit looking at Kansas's foster care system. The audit was requested by Senator Faust Guido. Ashley Beeson-Manus, Sam Dadds, Megan Flanders, and Jessica Sloan were team members. Kristen Ridinghouse managed the audit. So I'll start by talking about the two audit questions and giving you the brief answers to those questions. And then I will work through those two questions in further detail, kind of working through the body of the report. And I'll start that out with some background information. But to start with the questions and their answers, the first question asked whether the tasks in foster children's case plans were reasonable and relevant to their reunification with their families, and whether those tasks were being completed by children's parents. We found parents' tasks for reunifying with their children generally were reasonable and relevant, and that parents were either making progress on or completing those tasks. The second question asked whether outcomes for children in foster care varied based on kids' demographic factors. We found that outcomes did vary based on the 4 demographic factors we looked at. Those factors were race, ethnicity, age, and sex, and I will talk about the specific effects of each of those factors when I work through the findings in detail. Also, at your last committee meeting, you did approve an audit looking at foster care services for the health and safety of children. Just to clarify, this is not that audit. This is about foster children's tasks and their permanency outcomes based on demographic factors. So with that, I would ask you to join me on page 3 of the report for some background information. So first, district courts decide when children enter and leave the state's foster care system. While children are in the system, they receive case management services. DCF does not provide those services. They have grant agreements with 4 private case management providers who provide those services to children and their families. Those providers are Cornerstones, KBC, St. Francis, and TFI. As part of their work, the case management providers develop case plans. Among other things, these case plans should identify the way or ways in which a child is trying to leave the foster care system. A child will have 1 of 4 permanency outcomes as a goal. Reunification or reintegration is when a child goes home to the parents from whom they were removed. This is the preferred way for kids to exit the foster care system. But there are 3 other outcomes: adoption, guardianship, and another planned permanency living arrangement like emancipation. To the extent that reunification is the focus of this audit, that's really what I'm going to talk about, but there are definitions for those outcomes on page 3. In addition to specifying how a child's trying to leave the system, case plans should also include tasks people like parents need to do to help that child exit the system. Case management providers do prepare these case plans and the tasks, but they're not the only ones who have input on the tasks. Parents and others are assigned. For example, parents and children who are old enough should be included in the case planning process. Other parties like attorneys or guardians ad litem might also be included in the case planning process. And at court hearings, judges also have an opportunity to weigh in on what may or may not be appropriate. Also, parents are not the only people who can have tasks. For example, case managers might also be assigned tasks. But again, because the audit question is about parents' tasks, that's really what I'm going to be talking about here. And just to clarify, when I say parents, I am generally talking about kids' biological parents. The folks from whom the child was removed, it's generally their biological parent or parents, but it might also be like someone like a grandparent. So to put this all in context, let's say we've got a child who goes into the foster care system because their parents were physically abusing them. That child might have a permanency goal to reunify with their family in a home that is free from physical abuse. Their parents might be assigned tasks to do things like attending or management classes or learn appropriate discipline methods. So, with that background information in mind, I will move on to some details concerning question 1 findings. which again, reasonable and relevance of parents' tasks. I do have 3 things I want to cover here. So first, I'll talk about the extent to which we found tasks unreasonable or irrelevant. Then I'll talk about whether those tasks seem to affect families' abilities to reunify. And then finally, I'll talk about the extent to which parents were completing their tasks. So first, regarding task reasonable and relevance, we did review 48 children's case files to see if the tasks assigned to their parents seemed reasonable and relevant. We didn't find that parents were assigned an unreasonable number of tasks. On average, parents were assigned about 11 tasks across the life of a case. There's more information about that on pages 6 and 7. Continuing from the bottom of page 7, we did review about 670 tasks. We thought 90% of those tasks were reasonable and relevant. We thought tasks were reasonable when they reflected appropriate expectations. That is, they weren't excessive or overly burdensome. And we thought tasks were relevant when they addressed why the child was removed from the home or other risks to their safety. But about 10% of the tasks we looked at did seem unreasonable or irrelevant. That's roughly 70 of the 670 tasks we reviewed. About half of those 70 tasks required parents to do things like maintain stable income, submit to drug testing, or maintain a safe and stable home. So for example, in one of the cases we looked at, we saw a parent was asked to submit to drug testing, but the case plan itself said that nobody had any concerns about that parent's substance abuse, which really begs the question, why are they being asked to submit to drug testing then? As far as the other half of the 70 tasks we looked at and thought were unreasonable or irrelevant, there really weren't patterns in the types of those tasks, but the commonality was they seemed to address problems that didn't seem to exist based on the documentation we reviewed and the interviews we conducted. There are 2 things to keep in mind when you're considering our result. So first, this was a non-random selection, so our findings are not projectable. And second, we had to use significant professional judgment when determining whether tasks were reasonable and relevant. There are no clear criteria for what makes a task reasonable and relevant. We did use interviews and policy reviews to inform our judgments, but we had to draw our conclusions about each task in the context of the case in which it was assigned. Reasonable minds may differ on what is or isn't reasonable and relevant. If you go too far with assigning parents tasks, you might place an undue burden on them and either limit or make it impossible for them to reunify with their kids. At the same time, if you don't go far enough with assigning parents tasks, then you might end up reintegrating a child into a home that isn't safe or putting them in a position where they're going to reenter the foster care system, and neither of those are desirable outcomes either. So then moving on to my second topic, which is how these tasks seem to affect families' abilities to reunify. Bottom line here is we didn't think the presence of unreasonable or irrelevant tasks prevented families from reunifying. So families did reunify in 25 of the 48 cases we looked at. In 14 of those cases, so a little more than half, parents had at least one unreasonable or irrelevant task, and they went on to reunify with their kids anyway. 8 cases ended in other outcomes like adoption. There also, half of the cases included at least one unreasonable or irrelevant task. And then the remaining 15 cases were ongoing at the time of our review. But the bottom line there is the presence of these unreasonable or irrelevant tasks doesn't seem to ensure that parents won't go on to reunify with their kids. I don't want to suggest that this means that these unreasonable or irrelevant tasks aren't problems per se, because they can place burdens on parents. For example, going back to the drug testing example, if that's not a problem, then it could place an undue burden on a parent, especially if they've got a job or that they lack transportation. It could be difficult for them to find the time to routinely go to that drug testing. We also saw some cases in which parents were required to pass multiple drug tests before they could visit with their kids. So in the absence of reason to have them do that, that could be putting up an unnecessary barrier between them and their kids. And then my final topic for question 1 deals with task completion. So in terms of task completion, parents did generally complete or make progress on their assigned tasks. Information about that is on pages 9 and 10 of the report. But parents did not complete all their assigned tasks. This was in part because some tasks were ongoing tasks. So for example, if you have a task to maintain a safe and stable home, that never really comes to an end. You're expected to do that through the life of the case. So in some cases, parents just can't complete the task because it doesn't have an endpoint. But it was also because judges and case managers said parents don't necessarily have to complete all of their assigned tasks to reunify with their kids. They said if parents have addressed safety concerns, if they have a safe and stable home, if they've shown behavioral changes, it may be appropriate to go ahead and reunify families even if the parents haven't completed all their tasks. I do think, though, that kind of begs the question as to whether those tests are actually relevant to families' reunification if they don't have to be complete. So those are my comments on question 1. Moving on to question 2, which again deals with relationships between kids' demographic factors and their foster care outcomes. First, a little more background information. To answer the audit question, we reviewed foster care data from 2012 through 2020. That data concerned about 28,000 cases in which children both entered and exited the foster care system. Our analyses did not include children who were still in the system at the time of our review. In addition to the 4 outcomes I talked about in question 1, there were 2 other outcomes in the data. Those 2 new outcomes were transferred to another agency and an other category. Transfer refers to when responsibility for a child shifts from DCF to another agency, such as the Department of Corrections or a tribal court. And the other category captures other situations, such as when a child runs away or dies. And for this other category, please do note we do not discuss it as part of our findings. That's because we weren't confident in our analyses accounted for enough information to really evaluate that outcome. And please also note those 2 outcomes I just talked about, they are not outcomes kids would have as goals in their case plans. And finally, a caveat. We can't say exactly why there might be relationships between a child's demographic factors and the outcomes that we looked at. It could be that something like race does directly affect a child's outcomes, or it could be that something like race is linked to something else that we didn't look at, like income, and it's actually income that's driving what we saw. So there's likely more work to be done in this area to really fully understand what drives children's foster care outcomes. This is really a first step in that process. So then if you join me on page 14, I will talk about the relationships between children's races and their outcomes. Figure 6 on page 14 shows how children's outcomes compare when you split kids up based on race. For each demographic factor, we did have to use one group as a baseline. Here, white kids are a baseline because they represent most of the foster care population. The figure shows how outcomes for children of other races compare to white children. But based on this information alone, these descriptive statistics, we can't say whether children's races caused the differences we see. Hypothetically speaking, for example, it could be that black children and American Indian children happen to enter the foster care system at older ages than white children, and that's what's causing the differences in the figure. So to isolate and evaluate the effects of each demographic factor by itself, we did a series of regression analyses. These analyses helped us check whether specific demographic factors on their own had effects on children's outcomes. So going through the results for race, there's detailed information about this on pages 16 through 18, but in brief. Relative to being white, being black reduced a child's odds of reunifying with their families or entering a guardianship. And being black increased a child's odds of emancipation or being transferred to another agency. We interviewed the case management providers and a KU professor to understand why we might be seeing these relationships. They identified things like bias, mistrust in the system, and lack of resources as possible explanations. There's more information about those explanations on pages 16 and 17. And again, relative to being white, being American Indian, reduced children's odds of reunifying with their families. Being American Indian increased children's odds of transferring to another agency. This is likely because of the Indian Child Welfare Act, which requires child native care cases to be transferred to tribal courts in some instances. Our analysis did not show a relationship between being Asian or Pacific Islander and children's odds of experiencing specific outcomes. We also didn't identify any relationships between race and children's odds of adoption. So second, talking about the effects of ethnicity. Information about that is on pages 18 and 19. So first, ethnicity refers to whether children were of Hispanic culture or origin. And we found that relative to being non-Hispanic, being Hispanic increased a child's odds of reunifying with their family, while it decreased a child's odds of being adopted or emancipated. The folks we interviewed said this could be because Hispanic families tend to have stronger community support networks. They said this could help families be more successful in reunifying. Third, the effects of age. For this, information is on page 20. What I would ask you to do is focus on figure 9. The figure shows how often children achieved each of the outcomes we analyzed based on the ages at which they were removed from their homes. The ages are there on the bottom axis. Our regression analyses showed that age had a statistically significant relationship with all of the outcomes in the figure. So for example, children who were removed from their homes at older ages had lower odds of reunifying with their families or being adopted than younger children. Instead, those older children had higher odds of entering a guardianship, transferring to another agency, or being emancipated. Again, the people we interviewed said these relationships could be due to perceptions about children's behaviors, their access to benefits, and their personal preferences. There's more information about those explanations at the bottom of page 20 and the top of page 21. And fourth and finally, the effects of sex. So there's only one significant relationship here, and that was that being female relative to being male decreased a child's odds of being transferred to another agency. The providers we interviewed said this could be because people judge male children more harshly when they act out. This could mean they're more likely to come in contact with law enforcement or to face harsher penalties when they do get in trouble. And lastly, on page 22, we talk about how Black children appear overrepresented in Kansas's foster care population. So those are my comments on question 2 and the audit report in general. So with that, I would be happy to stand for questions at the direction of the chair.
All right, thank you, Josh. And we appreciate the overview. Committee, it's time for your questions for Josh. I guess I will just ask one question. I know that the original question from Senator Alita Fascudos was, do outcomes for children in foster care vary based on factors such as age, race, or ethnicity? We did see in terms of race a difference between outcomes. Did another factor such as one parent or two parent home play any part of your findings?
We didn't look at data about family structure, but that is a suggested data point that people in general think would be a good idea to look at because that could have an effect, especially thinking about things like family stability.
And it may correlate with kids in foster care overall across the spectrum from all ethnicities, or can't even say that word, or races or age groups, because if they're in a foster care system, it may be in a situation where they only have one parent, which would put them typically in a higher risk category. So any other questions from our committee? Yes, Senator Olson and then Representative Burrows.
Thank you, Madam Chair. I guess my question goes back to the task, the 70 task or whatever out of the 670. To me, I mean, I could only imagine how many of these kids, the parents just give up because they can't complete some of these tasks. I mean, how deep did we look at the ones that, couldn't complete the task at all? I mean, did we look at the ones, when the task was too tough and they just didn't complete it? Trying to complete it, and, the parents overwhelmed. I know we got some judges that are probably great. I know we got some other judges that are probably by the book or a little look at that. Were the judges or the, which one of these groups they were given the recommendation of the task? Was it too extreme to intentionally pull that child from that home, where it wasn't a severe? I mean, how deep did you look at these cases?
So we didn't evaluate whether DCF made the correct determination when deciding to remove a child from their home in terms of looking at tasks that were unreasonable or irrelevant. We did conduct interviews with case managers who assigned some of the unreasonable or irrelevant tasks that we identified. We also reached out to a number of parents to get their perspectives. And when I say that we found tasks to be generally reasonable and relevant, I don't mean to say that they were easy for parents to complete, because that is not necessarily what we heard. For example, some parents told us there were lengthy waiting lists to access the services that they were required to get to. They talked about challenges communicating with their case managers in terms of coordinating things like services. So, while we didn't rate tasks in terms of toughness, we did look to see if they weren't, absurd, requiring somebody to attend 2,000 hours of parenting classes. I would say that would be excessive. We didn't see anything like that, but it is very likely parents did face significant challenges in completing their tasks.
Thank you.
Representative Burrows.
Thank you, Madam Chair. Was there a significant difference in urban versus rural settings in reference to child placement. In other words, in cities where the larger population for child placement may be available versus those for the rural communities.
Could you clarify what you mean by child placement?
When the child is taken into children in need of care, it's more difficult for the rural communities to have access to the services. Is there a difference between the two in the agencies themselves stepping up providing services?
We didn't look at issues related to placement while children were in foster care as part of this audit. That might be something that our next audit touches on. I know it's something that we covered in the 2017 foster care audit, but that was not something we looked at in this audit.
Thank you. And committee, I'm looking at page 11 in reference to the DCF, at the bottom, mishandled investigations, and I'm sure that's somewhat, I don't want to say tainted, but somewhat slanted, because I'm sure parents don't want to have their children taken from them to begin with. But we are aware that we've had a tremendous turnover within the DCF and limited resources within the DCF. But in this study, did it verify that there are more children in state custody today than there have been in previous years?
It did not.
Thank you. Thank you.
All right, Senator Ware.
Thank you so much. On the last page here, it looks like that Black children are represented by twice as high a percentage in foster care as the population, and the reverse pretty much is true for the white children. Do you have any insights as to what is going on there?
So if you look at the bottom bullet on that page, page 22, the case management providers and professor we interviewed, they said this could be because of Black families' contact with mandatory reporters. These are folks who are required to report concerns about things like child abuse. So if Black families have increased contact with these mandatory reporters because, for example, they may make more use of social services, they could be more exposed to the system to the extent that folks might have biases that might cause them to be over-reported and thus more often investigated and more often removed from their homes.
Okay, committee, in order to stay on schedule, what I'm going to ask you to do, if you have further questions for Josh, you can email those. Also, reminder that we have a foster care advisory committee that has been, or panel that has been put together to look into these issues. And as Josh mentioned, there's another variation to this for foster care that we approved in May. So I think it's going to be something that's going to be on the legislative's, agenda for a long time, because it's a difficult, it's difficult item to ever, solve or to get to a place that we're all comfortable. So with that, committee, I'd like to let you know that we do have DCF that's via WebEx available for questions. We have St. Francis, Cornerstones, KVC, and TFI. So I'd like to pause and see if the committee has any questions for any of those entities. Yes, Senator Thompson. And please state who you'd like to direct your question to.
Actually, this is kind of a broad brush question. Thank you, Madam Chair. You've got this data, and, I guess my big question is, what do you do with it? And you said that there's going to be an advisory committee on that, but is there anybody who can speak to what they gleaned, or was all this kind of intuitive, reaffirming what you probably already knew? And what do you see as improvements going forward?
Would you like to direct that to DCF or?
Sure, that'd be great.
Okay. Is Secretary Howard with us or someone else?
Hi, I'm Melinda Klein, and I'm Deputy Director of Permanency. And so I think in our letter in response to the LPA, the audit, and what Josh was able to share with us, we gave a response that we were already working on some of those things. In particular, the race issue and disproportionality. And we found the audit results very helpful in directing that work. We're also working with Kansas Strong. They have a Change the World project that is looking deeply into implicit bias within systems. This is a nationwide disproportionality and disparity of within the child welfare system is rather nationwide, not just a Kansas issue, which doesn't mean that Kansas shouldn't be looking into it, because we are, and figuring out what steps we can go in to make a difference. So we found it to support and validate the information that we had already kind of uncovered within our system. I'm not sure if that answers your question, Senator Thompson. But that's we're using it to validate the information we already have and support the direction we're going to help us do something about the disproportionality and disparity within our system.
I appreciate that. And I think one thing that pointed out was familial differences. Like you said, with the Hispanics versus the blacks, there are differences there that may have an impact. And you know, so I just want this to have a positive outcome. You do a study like this and want to be able to have that data be used. That's my concern. Thank you, Madam Chair.
Okay, sure. Melinda, really quick, we were just chatting, Senator Tyson and myself. Can you kind of quickly review with us the advisory committee? How does that different than the special committee that was established in 2020 for foster care oversight, and who is chairing that so that our committee can follow up with those individuals that might be on that committee?
Our director is also on, so I might need a little bit of help with that. Or I also see Christine Wheat is on, and so they might have more information than I do about the how that advisory committee works. Do either of you know? Christine, Scott has disconnected. He sent me a message that he got disconnected. So
Okay.
I might need a little help with that.
Right.
Okay, well, go ahead. I'm sorry.
Yes, so welcome. Thank you, everyone. That advisory is in development right now, and so we'll have more information soon coming on that as we are, as it's still in development. But I would, if you guys have any other specific questions, I'm open and would welcome.
Yes, so is that different and distinguished from the special committee on foster care oversight that we established in 2020?
Yes, it is different. We are, we have a different scope. We will, of course, be working together and looking at the information that each has. But yes, it will have a little bit different scope.
Okay, so if you wouldn't mind, if you could provide information about the two different groups and how they are different, who served on either one of those or will be serving, and provide that to Justin with the legislative post-audit, or Josh, who did the audit, that would be great. And that could be distributed back to our committee. And of course, committee, you know, as a reminder, Justin always does share this information, LPA, with those that are working on it, and they'll receive it, they'll be able to ask questions and move from there. Any other questions from committee? Thank you very much.
Thank you.
If there are no other questions, thank you again, Josh. Thank you for representing DCF and for all those that are online or with us today. It's hard work, and I know we'll be talking about this for the next session and onward. With that, we're going to go ahead and move on to the next item on our agenda. The next item would be the KDHE death certificates, and I'd like to recognize Macy from LPA to present this audit. So if everybody would switch gears.
Right. Can you hear me okay? All right. Madam Chair and members of the committee, my name is Macy Smith, and I will present our audit comparing the impact of COVID-19 on death rates for 2019 and 2020. It should be in your packet. This audit answers the question, how did causes of death during the COVID-19 pandemic compare to those before the pandemic? I'm going to jump around just a little bit in the report, but I'm going to let you know where I'm at throughout. So we're going to start at the bottom of page 4 under the first bolded text. It's going to be the first bullet point. So to answer our audit question, we analyzed death records for the time period of September 1st through December 31st of both 2019 and 2020. At the time of our review, death record data was provisional and may not include every death in that time frame. Codes are assigned to each cause of death listed in the death record, and there are thousands of cause of death codes. So to look at how causes of death compared, we used a method used nationally that rolls up the thousands of codes into different umbrella categories. So for example, you'll see the category unintentional injuries in the report. So this category would include motor vehicle accidents, falls, or accidental drownings. So using that method, we reviewed death record data and found that the leading causes of death didn't change much from 2019 to 2020, except for additional deaths due to COVID-19. So if you look at figure 3 on page 5, you will see a list of leading causes of death in Kansas for the last third of 2019 and 2020. So 2020 is the dark blue line and 2019 is the gray. If you look at the different categories like heart disease, cancerous tumors, or strokes, you can see that the number of deaths due to those causes were generally similar for 2019 and 2020. If you look at deaths due to COVID-19, there were 0 for that September through December time period of 2019, but there were 2,608 in 2020. The increase in the total number of deaths during this time period from 2019 to 2020 is largely attributable to COVID-19. And you can see this demonstrated in figure 4 on page 6. There were 3,331 more deaths in the last third of 2020 than 2019, and COVID-19 accounted for 78% of those additional deaths. Next, I want to turn your attention to the process of determining and recording cause of death. So if you will look at figure 1 on page 2, you will see there are 4 main stakeholders: KDHE, the National Center for Health Statistics, funeral directors, and medical certifiers. Medical certifiers are either coroners or the doctor last in attendance. So turning to page 3, you will see the typical death record process. In essence, funeral directors start the process by entering demographic information into an electronic form. The doctor or coroner, that's the medical certifier, then enters the cause of death into the death record. This is sent to KDHE, who sends the data to NCHS. And NCHS, again, is the National Center for Health Statistics. NCHS assigns standardized codes to the death certificate. Finally, the form is sent back to KDHE, who records the information. I want to note that only the doctor or coroner can make changes to the death record for cause of death. Also, KDHE and NCHS have several quality checks during the process, and the process can take several months to finalize. We have a sample death certificate in Appendix B on page 8, and if you look at the highlighted portion, you'll see the form has lines to list several causes of death. So NCHS uses a largely automated system to code each of those causes of death, and their system determines the underlying cause of death. So to determine the underlying cause of death, there are a set of rules. Those rules generally determine the underlying cause of death by the order that causes of death are entered into the death record. So for example, and this example is on page 4, where causes of death are listed as A, asphyxia, B, crushed chest, and C, car accidents, the system would ask, Can asphyxia be due to a crushed chest? Yes. Can a crushed chest be due to a car accident? Yes. So a car accident on line C would be listed as the underlying cause of death. Underlying cause of death is typically what is used to report leading cause of death statistics and is what we used in our report. That concludes my presentation, and I'm happy to stand for questions.
Committee, what questions do you have for Macy? Yes, Senator Tyson.
Thank you, Madam Chairman. Thank you for your presentation. I do have a couple of questions. We had a situation where I was approached. The cause of death was listed as COVID. However, the family knows that the person had a massive heart attack on the way to the hospital in an ambulance. They had been to the hospital prior. They thought they were having a heart attack. The hospital sent them home, and they called the ambulance, and they died in the ambulance on the way to the hospital. So the cause of death is listed as COVID. The family is not having any luck or success in changing the cause of death and the death certificate. And I know this is a little bit over and above, but for this audit, did you look at those types of scenarios, or did you just take the numbers that were presented from KDHE, the death certificate itself?
So we took the death record data, and those causes of death that were listed by the medical certifiers, and that is the data we used for this report.
If I may, Madam Chair, follow up. Did you, or there were many rumors as to money being tied to the cause of death being COVID? Was there any investigation on that?
So for this report, we only looked at the comparing causes of death.
Will that be a follow-up, Madam Chair? And thank you.
This is actually a short 100-hour audit, but we may have room for additional audits, short-hour audits this year. Is that right, Justin?
Madam Chair, yeah, we can always typically accommodate more 100-hour audits. So if pursuing that were of interest to the committee, we'd have to work with you, Senator Tyson, or other members of the committee interested to scope that out and determine what could be done in 100 hours to potentially look into that concern. Sometimes we can do that, sometimes we can't.
Yes, Representative Gardner.
Representative Gardner, Senator, can you explain your question? I guess I'm a little confused when you say money. What are we talking about exactly?
Yes, Senator Tyson, you can explain.
Thank you, Madam Chair. I didn't want to speak out of order, so thank you. There have been many rumors or statements made that the hospitals or there was money tied to if it was a COVID death. I don't know, and that's why I would like to see more of a legislative post-audit digging into that. You did a great job on this report, by the way. This is nothing against. I'm new to the committee, and I just would like to expand your scope a little bit. So thank you.
Yes, Senator Olson.
Yeah, I believe that there's a process, if there's a mistake, to go through and fix that. And I know there is, actually, because they had some mistake information on their death certificate of my father, and we followed the process, and it was not too painful to fix. It just took a little time. So I'm guessing there's a process, but I can just say for my family, it wasn't too bad. So to fix if there's a mistake.
All right, and Representative Topliker.
Thanks. You may have already stated it, but were the COVID deaths broken down by age?
Not in my report, but it is something that I can access for you.
Thank you.
If that's something, okay.
And it is found on KDHE's website, so you can check that as well. And I would note that there are a lot of questions around this particular topic. And so I do appreciate your questions here today. And I remember back in September of 2020, that I think it was 2020, when the CDC came out with a report that stated that only 6% of those individuals, Americans that died of COVID-19, had no other comorbidities. And so I don't know that we really know that in Kansas. I'm not sure if that is on the KDHE's website or not. But that would be interesting to know as well. What percentage of Kansans do they represent or reflect the United States as a whole? But we might be able to find some of those answers just by talking to the Secretary of Kansas Health and Environment and see what kind of answers that we could get on that. Any other questions? Senator Tyson.
Thank you, Madam Chair. We did request data from KDHE last year regarding an overlay of the flu, pneumonia, and COVID. And we were never able to get that data. We did not receive it. I wonder if legislative post-audit would have better.
I'm not, what do you mean by overlay?
So those individuals that might have had a tiered, they might have had whether or not they had flu as a cause, or if they had pneumonia or others. Is that correct, Senator? And I think we were on the recovery committee, special committee for recovery when.
That's exactly what it was, and we made that request for data and we never did receive it. So I don't know if that would be within the purview of this scope, of this post-audit, but if it would be, or maybe we could add it to the next 100-hour audit.
I think it, Macy, I don't know I want you to respond to that, but it might be something that we could just do a follow-up.
Yeah, I'm trying to think about the data that we have, and we did not compile it in a way to look at what I would think maybe comorbidities or that overlay. We just looked at underlying cause of death.
Thank you. We're looking for what we were looking for. All of a sudden, nobody died from the flu or pneumonia last year or the year before. So what we were looking for was the pattern in previous years, flu, pneumonia, and then in 2019 and 20, also flu and pneumonia and COVID cases.
So if you want to, at figure 3, those are the leading causes of death for the time period we looked at. And influenza and pneumonia is on there for 2019 and 2020. And these are generally the leading causes of death over numerous years. Now that I can't speak to the numbers, but I can speak to how they're kind of ranked.
Okay, Senator Thompson.
Thank you, Madam Chair. No, good job. We appreciate this. And I think the questions raised by Senator Tyson, I'd like to reiterate that if we do a small additional scope audit, I'd be very interested in knowing, A, when the financial incentives, I don't want to call it incentives, but when did the money start coming in for, and I know hospitals were getting more money for COVID patients, and I know that there was some rumor, I don't substantiate it, I can't remember where I read it, but as much as $30,000 went per COVID patient. So I'd be very interested in knowing if you can find out, A, when that money started flowing, and see if you can correlate the increase in COVID deaths with when that money started coming in. How much did hospitals get for COVID patients? How much were any deaths attributed to COVID financially subsidized in some way? I think that's
Senator Thompson, that's a great idea. I'd ask you to work with Senator Tyson and see if you can combine those ideas.
Absolutely.
Your idea of cost and the other one regarding comorbidities may not overlap perfectly. They may need to be separate in order to stay within the confines of a 100 hours. But either way, I think that any of the committee's ideas, they can be vetted and taken to LPA, and they can help you come up with the questions that you need. And then this committee would then choose to approve or not. Sound good?
Sounds great. Thank you,
Okay.
Madam Chair.
Because this is just a
Thanks, Mason.
sharply focused audit, short audit. And so are there any other questions about the question that was presented? Yes, Representative Gardner.
Thank you, Madam Chair. Just a comment. I guess if we go down that road and start looking at cost related to increase the cost for COVID patients to hospitals, or the subsidy, I think we also ought to look at the actual cost to the hospital of intubating someone for weeks that have COVID. So, I mean, if we're going to look at the subsidy, let's look at the cost also, Madam Chair.
Okay. All right. If there are no further questions, we do have officials from KDHE that are available via WebEx. And are there questions? And thank you so much, Macy. Any questions for KDHE representatives? And just to note that there were some questions last year that did not get answered. If you still have those on file or via email, if you could get back to Senator Tyson, that would be greatly appreciated. And then if you would share it with our legislative post-audit. Okay, if there are no further questions, we'll go ahead and close this portion of our meeting. Next, we are heading to the consent calendar. I'd like to recognize Kristen to explain the consent calendar items, and they're going to be found on tab B.
Just to clarify, do you want me to move to the consent calendar or talk about there's a statutory audit?
Oh, yes, I actually skipped that, so we're moving backwards to the statutory audit proposal. Thank you, Kristen. And that's tab A.
Yes, thank you, Madam Chair, members of the committee. So I am talking about tab A. So this past session, the legislature passed Senate substitute for House Bill 2313. That includes a provision that would have you all direct us to study the economic impacts of tax or exemption differences for government and nonprofit organizations that compete with similar for-profit businesses. So Chris Clark from our office took that provision, turned it into an audit proposal. That's what you're seeing in tab A. So we're simply here today to answer questions that you have, but looking for you all to approve or modify and approve that audit proposal so we can get started on it.
We're opening up for questions for Kristen on this item. No questions about what was passed in Senate substitute for House Bill 2313. If not, if there is someone that would like to make a motion to approve. All right, a motion has been made by Senator Olson. Is there a second? Okay. Senator Tyson has seconded. Any further discussion? Yes, and Representative Toplicker.
What exactly is the goal for this proposed audit? What do we expect to study or find or not find?
Krista, would you like to answer that, or I can ask Senator Tyson, who's familiar with it?
I would appreciate that.
Okay, Senator Tyson.
Thank you, Madam Chair. I'd be glad to answer that. We had a little bit of controversy this session over a health club bill. They wanted to be removed from all property tax because they are competing with nonprofits and government entities. And before we move forward on legislation, we'd like to see the impact for all industries that are competing against government and non-profit industry. So we're hoping that this gives us the data and the information that we need before we move on such large legislation.
Yes, Representative.
Real quick follow-up. So is this specific enough for what you are looking for? Do you think that this will give you the information that you need?
We're hopeful.
Just want to make sure. Thank you.
I just have to opine for a second. I struggle with the idea that when we, we try to, our base gets lower, and so we have fewer people paying in, and so then that rate has to go up. And so I'll be interested to see what this has to say, but that is a very controversial topic, isn't it? Yes, okay. So we have a motion, a second, and Representative Gardner.
Just a question, Madam Chair. I mean, this could get very, very large in conducting this audit. And we're talking about a sample. So will it be a sample? How large will a sample of different industries across the state that are not-for-profit competing with for-profit entities? Is that the way you see this coming together, I guess?
Yeah, so I can say right now, we don't have all of those details worked out. Of course, once we kick this off, we'll start having more conversations about that. But the way to try and limit time would be to look at a sample. So we'll have to kind of figure out what we think it's going to take to get a meaningful answer, and then how many we can look at to get that back to you all, because there is a timeline with this one. So we do have to report back on or before January 15th of 2022. So that will partly dictate the methodology that we use there.
All right, thank you.
Senator Olson.
Thank you, Madam Chair. Yeah, this issue's been around a lot longer than just one session, John. It's been around 10 or 12 years. And as you know, in our community, we've seen a lot of health clubs come and go. And, we built the community center a few years ago. It's an asset, but let's find the right balance for government. And if one's tax exempt, should the other, or let's find that fairness to business. I'm sick of seeing these health clubs, as you know, in our community, come and go. These buildings stay vacant for a period of time, or they constantly change the names. We've got some at 119th that were there, now they're gone. We've got some that were at 135th, they were there, now they're gone. It just seems like, our community is a prime example of where it's revolving door. And there could be other situations. I'd kind of like to see this put to bed once and for all, instead of be around this building for another 10 years. And so I'm kind of excited about this audit. I think we need to learn more and find a better balance for government when it's competing with private business, where it's not putting them out of business. Thank you.
Well, and I would just note that government isn't competing with the majority of these. They are nonprofits, such as the YMCA, in which they are providing sliding services, daycare services, summer camps through donors. And so I suppose if all health clubs were doing just the same thing, then we might have an even playing field, and that would make sense. But I do realize this is not us debating on the floor of the Senate or the floor of the House. So we're just getting information, collecting that information. I'm sure it will not be complete in order to make that final judgment. It would be something that each one of us would have to make sense of, take that information and put it together with other aspects of the equation, because I don't think that we're going to agree on that issue, but it was found in legislation, and we're going to take a look at it. So I look forward to discussing that in 4 months. And let's see, that will be before session, should be. Is that right?
That would be correct.
Okay. All right. Any other questions about this proposal?
Just one more.
Representative Topiker.
So we've been, excuse me, we've been talking a little bit about health clubs, and but this says governmental, you know, this talks about other entities. And so I'm wondering, what about these, like, say, wedding venues what about things like that?
It could be that, it could be lodges on a lake.
This is just kind of a
Yes,
catch-all
golf
thing.
courses, it could be any of those things.
And it's going to, maybe the audit will develop as we move forward, or what, how does this, we're not just looking at health clubs.
No, it does not specify health clubs.
Okay, thank you.
All right. If there are no further questions about the proposal as it is written here today, all those in favor say aye. And those opposed? All right, looks like it passes. Thank you. Now, Kristen, we can go to the next item on the agenda, which is the consent calendar.
Okay, thank you. So now I'm on tab B, if you're following along here. There are 3 things on today's consent calendar. The first of those is to approve the minutes from the May 5th meeting. You can find those in attachment A in tab B. The second item on the consent calendar is the acceptance of the performance audits that were presented today. So that would include the foster care case plans and also the comparing the impact of COVID-19 on death rates. And then the third item on the consent calendar is the approval of limited scope audits. So today there are actually 2 of those. You can find those in attachment B. That's also in tab B. So there are, like I mentioned, 2 of those. Both of those, actually, just for your all's reference, are things that were raised at the May meeting, and you all directed us to kind of work with the chair on turning those into limited scope audits. So we have done that. The first one would be looking at evaluating the need for developmental education courses, and the second one is kind of like our follow-up audit process. So we would review, in this case, one audit. It's the Senate Bill 367 recommendations from a prior audit. And what the agencies have done. I'm happy to answer questions about any of those if you have them.
Are there any questions for Kristen? All right, so if there is a motion to object, I will take that motion to any of those consent calendar items. Otherwise, if there are no objections, then all items are approved. Okay, thank you, Kristen. The next item on the agenda is we are moving into the executive session item. So I'd ask Justin to announce who can attend the executive session, and then after that, Senator Tyson to provide the appropriate motion.
Thank you, Madam Chair. Just a reminder, committee members, this is a necessary step to make sure that we follow the Open Meetings Act. Revisers have been working with me over the years to make sure we are protecting your all's interests. So I'm going to just list the names of people that can stay for the various agencies. We will funnel them in and out of the room for you, but that allows us to then have a single motion instead of having to come back and forth in between public and executive sessions. So for the Kansas Department for Aging and Disability Services, we'll have Jason Cohn and Jeff Maxon. For Blue Valley School District, we'll have Brian Daly, Stan Turner, Tyler Davis, and Evan Nichols. And then for the Emporia School District, we'll have Allison Harder, Rob Scheib, and Paul Beatles. Thank you, Madam Chair.
And Senator Tyson.
I move to recess this open meeting for a closed meeting pursuant to KSA 754319A to discuss matters relating to security measures that protect the Kansas Department of Aging and Disability Services, Unified School District Number 229, Blue Valley, and Unified School District Number 253, Emporia, under the justification listed in KSA 75-4319 B12C, because of discussion of such matters in an open meeting would jeopardize such security measures. To resume the open meeting in room 546-S at 12:04 p.m. and to record this motion, if adopted, as part of the committee's permanent record.
A motion has been made and seconded. If there's no discussion, all the in favor, say aye. And in opposition, none. All right, thank you. We will go ahead and go into executive session. Okay, committee, we have a motion. We're going to go in for 15 minutes executive session, and Senator Tyson.
I move to recess this open meeting for a closed meeting pursuant to KSA 75-4319A to discuss matters relating to security measures that protect the Kansas Department, actually, we've already finished that one, that protect the Unified School District 253 Emporia under the justification listed in KSA 75-4319B12C. Because of discussion of such matters in an open meeting would jeopardize such security measures, to resume the open meeting in room 546 at 12:25, and to record this motion, if adopted, as part of the committee's permanent records.
All right, do we have a second? Okay, a motion has been made and seconded by Representative Gardner, and all those in favor say aye. All right, any opposed? Motion carries. We will go into executive session. We have returned from executive session, and I'm going to ask Justin to update us on next meeting dates and info.
Thank you, Madam Chair. Just a couple of final wrap-up items before we get you out of here. So as the Chair mentioned, kind of the primary business item is our next meeting will be sometime in late August. I'll be working with the Chairwoman to set those dates, but that's kind of what we're aiming for. That's because we'll actually have several major audits, which I'm sure the committee will be interested in at that date. One of those will be the Star Bonds Economic Development Incentive Audit. We know Star Bonds has been a real focal point of the legislature the last couple of years, so we have our evaluation of that program. We actually took that audit offline because we had some concerns with the Department of Commerce that we're trying to work out with them. So that's something we've stepped back to make sure we get you the best and most accurate information possible. So we postponed that a couple of months so that when we bring you the report in August, we'll have fully considered the department's concerns. And of course, sometimes we agree and disagree, but we're trying to really work that out. So that audit's coming, as well as part 2 of the unemployment fraud audit. We will be able to give you a much more precise and sophisticated estimate. We've given you an early estimate of $600 million, but that was a very rough methodology. We're going much further. We're also going to talk about delays in processing the claims and look at the call center and staffing and some of those issues. So 2 big outs. We also have some substance abuse programs audit and several others that will be on the agenda in addition to IT security audit. So that'll be a big meeting. Secondarily, Madam Chair, if I may, we had Sabrina DeSantis was here. I think she may have left after the hour-long executive session. She is our fellow this year, and so we brought her in to kind of watch the committee meeting. So she's from Kansas State getting her master's of public administration. So very glad to have her with us, and we brought her today to watch some of what's going on. She may have had to actually leave this afternoon. And then finally, you'll notice we have some cupcakes over there in the corner. It is LPA's 50th anniversary this July. So our office has been around for 50 years. So we actually had a former employee who is a talented chef and baker make us cupcakes with our edible logo on there now. So as you walk out, feel free to please grab cupcakes for yourself and any others as we celebrate that milestone. So that is all I have, Madam Chair.
50 years of fun. That's great. Okay. Well, thank you, committee, for being here today. I didn't mention, but Representative Barker was online with us today, obviously not for the executive session. With that, committee, if there are no objections, and even with objections, we are adjourned.